Amyotrophic lateral sclerosis, or more commonly known as Lou Gehrig's disease, is an illness that causes your body's muscles to wither away, leaving you useless. 1 in 20,000 people worldwide are currently affected by ALS, most of which will pass away within the first 3 to 5 years of their diagnosis. With ALS, your body's nerve cells begin to die, which prevents your brain from sending messages to the affected muscles. This usually begins at the legs, causing you to lose your balance, fall, and having the inability to stand up. For approximately 10% of patients, ALS is caused by a defect in your genes. For the rest of people, there is no definite cause. The disease slowly spreads to the rest of your body, gradually getting worse. When it gets to your lungs, it's near impossible to breathe without some sort of apparatus supplying you oxygen. Today there is no known cause for ALS with the exception of being hereditary, but there is no cure in sight either. It's a silent killer. You don't know when you're going to die, you just need to always keep in mind that sometime soon you will. Symptoms for ALS include breathing and swallowing difficulties, choking, cramps, speech issues, loss in weight, and weakness. This is all due to your muscles slowly disintegrating, causing your body to become dysfunctional. ALS is sometimes mistaken for a stroke because the two conditions share many of the same attributes. Neurologists are usually the people who diagnose ALS and tell their families to get their affairs in order. Things such as blood, breathing, and genetic tests, MRIs, or spinal taps can assist in this diagnosis. Although ALS affects practically your entire body, your sight, smell, taste, hearing, and touch are unaffected. Although there is no cure for Lou Gehrig's disease, in the sense of the word, there are treatments to ease pain and streamline day-to-day activities. Leg braces or wheelchairs can be used to increase mobility. Oxygen machines can be used to increase breathing when needed, whether it is only at night or 24/7. There is one prescription called Riluzole that slows down the progression of ALS. Even though it doesn't cure the beast, it will prolong life if taken as directed. Another drug called Ativan can be used for anxiety and/or depression and makes you sleepy in the process, as well as Tramadol, which is used to ease pain. If someone has trouble swallowing or food or is choking often, a feeding tube may be installed into one's stomach so they can be fed. ALS is usually aliased as Lou Gehrig's disease because he was the first famous person in North America who was diagnosed with it. Lou Gehrig was a baseball player for the New York Yankees and started in the early 1920s. In 1938, he began to notice a loss in strength and was diagnosed with a gallbladder problem. He then retired in 1939 before he was diagnosed with a very rare form of degenerative disease, amyotrophic lateral sclerosis. Amyotrophic, by definition, means absence of muscle nourishment. From this point on, Lou Gehrig's disease was known to more people than just your doctor. The ALS Society of New Brunswick provides services for patients of ALS as well as their families and caregivers. Every year, there are walks for ALS across the province to help raise money for ALS research, as well as helping families affected by ALS by providing things such as wheelchairs. Last year, the ALS Society of New Brunswick raised $80,000 for these causes, and they hope to raise even more this year. Anything helps. Every donation makes us that much closer to find a cure to this horrible disease.